Hi, I'm Anna. If you met me, you might think I'm really introverted or awkward, which is true, but it mostly stems from my anxiety disorder. I really want to be able to explain what it means to have a mental disorder. As someone who struggles with mental health, I think it is really important that we be knowledgeable about our brain and the different ways people function. I have been hurt a lot of times by ignorant and unfounded statements about anxiety. There are so many misconceptions about anxiety, like that it is worse because of social media, that because you feel anxious you have an anxiety disorder, or even when you get super nervous, even panicky, that you're having a panic attack. I hope that all of us, including myself, can walk away from this having learned something new and understand the people around us just a little bit better. To start, let's define anxiety disorder. It is most commonly defined as when excessive anxiety interferes with your everyday activities such as going to work or school or spending time with friends or family. Anxiety disorders are serious mental illnesses. One of the biggest things that I have realized in my journey with anxiety is how personal it is. This is something that affects every part of my life, so we need to ensure when we are talking about mental health that we are being cautious about the way we talk about things, because you don't know what sort of weight it could hold. Another thing that I think we don't realize is that each person's anxiety is different. First of all, depending on the type, which I will get into later, but also everyone's brain is different, so just because you understand how one person's anxiety works doesn't mean you'll understand another. Each person's mental health has little nuances to it. Now, there are multiple specific disorders that fall under the category of anxiety. There is general anxiety disorder. General anxiety is when the fear and anxiety affects and causes problems in numerous areas of life, where other disorders tend to be in more specific realms. GAD surrounds every routine life circumstance. A lot of people have heard of panic attacks, which is a part of panic disorder. A panic attack is when sudden fear or anxiety peaks in a short amount of time. They typically are brought about by a trigger and are sometimes unexpected. Another is phobia-related disorders. A phobia is a fear of a specific object or situation, which causes the fear to be out of proportion with the actual danger and reality of the situation. One of the most common forms of anxiety disorders is social anxiety disorder. This is very similar to general anxiety disorder, but almost all their anxiety stems from social situations. They worry about the thoughts of the people around them. A lot of people with social anxiety tend to avoid social situations due to their anxiety. Social anxiety manifests itself in many different ways. They have found that social anxiety affects men and women equally. A common anxiety found in children, but also people of all ages, is separation anxiety disorder. This is the fear of being separated from loved ones or someone they are attached to. PTSD also falls under this umbrella. Post-traumatic stress disorder is directly tied to a traumatic event, whereas other disorders can stem from other things. Now, there has been a lot of disagreement within the mental health community of whether or not OCD should be included. Obsessive-compulsive disorder is when someone compulsively stresses about something. They can't control their need to ensure that everything is in its place. Some people say since it does stem from anxiety, it should be included, but others say that since it has a lot of behavioral aspects that it could fall under a different umbrella. There are a lot of different conceptions about the things that cause anxiety disorders. I was shocked by the number of different things psychologists attribute to the cause of anxiety disorders. As well as the disagreement on causes, one of the biggest conflicts is to determine whether genes attribute to anxiety disorders. Psychologists have discovered that people can be predisposed to anxiety because of their genes, but currently there is no way to determine how much of an effect that actually has. This is due to the fact that anxiety is not attributed to one single recessive or dominant trait, which makes it a complex trait. This has led to the disagreement on whether or not genes are a cause, because there's not direct correlation between the two. There are some causes attributed to pre-birth and some post-birth. There is also environmental exposure before birth. This means whether your mother was using alcohol, drugs, or toxic chemicals while pregnant. This also ties into brain chemistry and the way your neurotransmitters carry data to different parts of your body. After birth, most of the causes have to do with experience and environment. One factor is a traumatic brain injury or traumatic event, even having few relationships. Psychologists have found that normally it is some combination of these factors that lead to anxiety disorders. There are a lot of different ways and types of treatment for mental health in general, but specifically anxiety disorders. The first two are probably the most well known. They are support groups and psychotherapy, or talk therapy. This is basically a session where you sit down with a counselor, whether individually or in a group, to talk about your anxiety and learn to manage it and think about it in a different way. The next is medication. Now, there's a lot of medication options that I didn't even realize existed. One thing to note is that medication does not cure your anxiety, but rather helps lessen symptoms and make your anxiety more manageable. In most cases and states, a psychiatrist must be the one to prescribe medication. There are two main types of specific anti-anxiety medication. The only problem with them is that people can build up a tolerance to the medication, so they are normally only prescribed for short periods of time. Psychologists have actually found that antidepressants, which are used to treat depression, can help with anxiety. Other medications are beta blockers that are originally supposed to treat high blood pressure, but this medication can help with a lot of the physical symptoms of anxiety like rapid heartbeat and shaking. The biggest thing to recognize about medication is that not all medications work for everyone, and that sometimes medication does take time to start working. So finding the right medication and the right dosage can be a process. Another type of therapy is cognitive behavioral therapy, or CBT, which is a type of psychotherapy that looks into behavior and how we react to anxiety. In CBT, you practice and learn social skills and techniques to handle and work through your anxiety. There's been a lot of research in the past couple of years to determine whether or not the use of technology, especially in CBT, is effective and beneficial. Overall, the majority of patients have improved by the use of technological therapy, but there has been some detriment for some people using this sort of therapy, because it could encourage more antisocial tendencies and not help people to engage with their anxiety. Obviously, in all cases of treatment, it is very much a personal preference and progress thing. So these results can vary and don't entirely represent the whole community. But overall, due to the success of it, they are continuing to look at how to best implement technology into treatment, since it does provide convenience and accessibility to people. There has been some disagreement on whether diet has an effect and should be considered in treatment. I've never really even thought about what I eat affecting my mental disorder. Some psychologists believe it does because they feel our physical health has a big impact on our mental health. But others disagree or discredit this since there is not clear-cut proof that this is effective. Most psychologists would not recommend a diet as a primary form of treatment. Stress management techniques are often something you learn in counseling, but are things you can apply to your life to help handle stress. They include meditation, mindfulness, breathing techniques, journaling, basically anything that will help you try and get your anxiety out of the irrational and into the rational, or to a point where you can address it. If you do struggle with anxiety, it will take time for you to find what works best for you. A lot of people find that a combination is necessary. For me, I take medication to help me manage the day-to-day anxiety, and then I see a counselor every other week to talk about bigger stressors. So sometimes people need to find a good mix of things to best suit them and their mental health needs. When it comes to treatment, there are a lot of barriers for people who are seeking help with their mental health. I never realized the stigma and shame that came with mental health and anxiety disorders. Once I was diagnosed, I realized how easy it was to make excuses to not seek out treatment and how hard it was to open up about my struggle. In this next part, we're going to talk about the barriers people face. I hope that by talking about it, we can start to eliminate that stigma and shame so that people can feel more comfortable talking about mental health and seeking treatment. The first big category is that people don't have knowledge about mental health, so they don't know where to go to find good, proper care. They have no idea where to start to look and what steps to take. The next is that they are anxious about people knowing they have anxiety. They want to handle their problems on their own and think that treatments won't actually help. Those are factors that mainly stem from this piece of embarrassment and shame. As someone with anxiety, I know what it feels like. You're worried you'll be judged for needing to see a counselor because it is such a taboo topic. Once I began to open up about my anxiety, I met lots of people who were seeing counselors and had mental health things as well. The biggest thing we can do right now is to love and support people who are struggling and work to get rid of the shame associated with mental disorders.